Are you a family caregiver? Is your loved one on hospice and are they talking about morphine? Are you wondering, is it safe? Is it a good thing? Well, that's what we're going to talk about in this video. And I'm a registered nurse with 30 years of experience, and I've owned my own care home for the last 10 years, helping people uh, move from this life into the next. And I have taken care of hundreds of people over the years on hospice and helped people understand the pros and cons of morphine. So let's jump into it and talk about why maybe there's this big problem with morphine. So people are all worried about people getting addicted to morphine, and that is a valid reason to not use morphine, but that's really something to consider for people who are not in the last stages of life. And what's that? What do I mean by that? I mean that if you are on hospice, then that means that a doctor has declared you to likely not still be alive in 6 months. You have some type of terminal condition. So that is a very different place than someone who is healthy and expected to live for many more years. If you're expected to live for a long time, then worrying about the addiction of morphine is a valid thing. But when you're at the end of life and you're caring for someone who is at the end of life, then you've got to think more about comfort. And, when I am taking care of hospice patients, I always am worried about their comfort. Are they clean? Are they dry? Are they in a happy place? And morphine is one of the ways that I worry I can help solve those comfort problems. So I'm not concerned about someone becoming addicted to it, even if they are on it for several months, or, some people are on hospice for a year or more. I'm still not worried about them being addicted to the morphine, because morphine at this point in time is really for their comfort. And the last thing that I want to see is someone who is just in pain, screaming and crying. And that is not good for them at this stage of life, and it will actually shorten their life being in pain. And so by keeping them comfortable, they're going to have a longer life in a lot of ways. But even if it does shorten their life from being on the morphine because it helps them to relax and maybe they give in to dying sooner, I still would rather see that happen than to have someone just be in agony. And I think that most families don't want to see their loved one be in agony. And people worry about, oh, well, if they have morphine, then they're going to just be sleeping all the time. Well, I have actually found that people get used to narcotics and they don't experience the drowsiness as much after their first few doses. Plus, I actually think that some of the other drugs that we use for anxiety, like lorazepam, actually cause more of that drowsiness effect than the morphine. I oftentimes see that I give morphine and they might sleep for a few minutes, but then they'll wake up and eat. And so I prefer to be able to keep people pain-free so that I don't need to give them so much lorazepam for anxiety and feeling tense and worried about whether they're going to be short of breath or in pain. Because the other thing that we use morphine for at the end of life is also for shortness of breath. It is a great drug for that. And that is one of the best things about morphine, is that it not only helps with pain, but also with that shortness of breath, particularly at the end of life. And so those are why I would use it. And I've been a nurse for a long time, working through how to keep people comfortable, how to care for them the best. And if you want more of my tips and hints, type tips in the comments down below and I'll send you my free easy caregiving guide. But morphine is a great drug to use. And I just want to show you my little bottle. I have someone in my care home who's currently on morphine, so I can show you what it looks like for someone who is on it. And usually for somebody that is on hospice at the end of life, what we'll do is we actually have liquid morphine, and we draw it up in a syringe. And so it's actually just a very tiny, tiny amount. It's 0.25 milliliters. And so what you do is hopefully your hospice company has supplied you with a bottle that has this insert on it and with a syringe. And if your pharmacy didn't, then definitely call the hospice company or the pharmacy and ask for them to give you this, because this makes morphine administration so much easier. And once you have that converter into the bottle, you just stick your little syringe into it and then tip the bottle upside down. It doesn't leak out because it's made to go with the syringe. And then you just pull back on the syringe to the amount that you want. And this bottle is almost see-through, so you can't really see you can't really see the liquid in it very well. It's just a light tinge of blue. And I've just drawn it right to here with the 0.25 cc's. And then what I would do is insert this into their mouth, under their tongue, or between their teeth and their cheek, and you just slowly squirt this in. And you might start with a very low dose. You of course want to do whatever dose the hospice company tells you to do, and that's going to be based on your loved one. How many narcotics have they had prior to this? Are they used to taking narcotics? And if they are, then they may need a higher dose. But there is a conversion that the hospice company can use through the pharmacy to figure out how much they need. And so but for people who haven't been on narcotics, then I'll just start with the smallest dose, the 0.25, and usually it's given every 1 to 2 hours, depending on what your hospice company has said. And I will give that, and then I will increase the dose as needed. And as a registered nurse, I can work with the hospice company to figure out the right dose. If you don't have that experience, then I urge you to talk to the nurse that you're working with the hospice company, and they will help you figure out the right dose. I'm going to just squirt this back in the bottle. It is a controlled substance, and so I always make sure that I keep track of where this bottle is, and I don't leave it sitting out. Unfortunately, in this world, we have lots of people that are addicted to narcotics, and I just always feel like there's no reason to tempt people. And so I keep it locked up, except for, when I'm drawing it up, I'll go in, I'll give the dose to the person, and then I'll relock this up so that people don't walk away with it. I've heard lots of horror stories about people who are on liquid morphine, and caregivers have actually filled the bottle with water or other things. And so if your loved one is suddenly not reacting to their morphine, like they're in terrible pain, even though yesterday they were fine, and you've had a different caregiver in there, it's important to check and see, is it still morphine in your bottle? It sounds terrible that people would do that, but I have heard those horror stories. So anyway, that's all there is to it, to give the morphine. And you would just evaluate. And if you give morphine to your loved one and they die 45 minutes later, don't feel like you killed them, because that's not at all what happened. Maybe it was just their time, and maybe they were so tense from their pain or their shortness of breath that once you gave them their dose, they were able to relax, and then death came to them. But it really was not you. So just remember that you're not causing the death, and you're not over medicating them. Morphine is a great thing for both you and your loved one. And I say you because the caregiving experience shouldn't be one of horror, of the nightmare of listening to someone scream in agony. And so use hospice for what they're there for, to help you find that right dose for shortness of breath, for pain, and for if you have anxiety, then catch my next videos, and we'll talk about lorazepam in a later video. If you have more questions, be sure to check out my other videos about caregiving, and I will see you in those.